Dog bite. Few facts. Rabies in India. Magnitude of the problem: 20,000 deaths, 17.4 million animal bites cases annually. India accounts for 36% of global and 65% of Asian human rabies death. In India, rabies is reported from all states except Lakshadweep and the Andaman and Nicobar Islands. No age or sex predictions. 96% of human rabies cases are due to bite from rabid dogs. Rescue. Most animals will not turn aggressive unless provoked. Staying away, not teasing stray dogs could prevent many unnecessary injuries. It is only wise to be equipped with a kit having first aid material when involved in outdoor activities. Before attempting a rescue, ensure personal safety before approaching a victim that is under attack. Always call 100 for assistance if you are unable to handle the situation alone. Canines are born with the teeth to hunt and an instinct that commands it to bite whatever target it considers as prey. These instincts could result in very severe injuries to the victim. Dogs are generally very protective over food, territory, youngs. When threatened, they will attack to protect them. Signs. Obvious signs of injury. History of dog bite, teeth marks, scratches, bleeding, oozing of blood from wound, single or multiple wounds, marks. Types of contacts. Category 1. Touching or feeding animals, licks on the skin. Category 2. Nibbling of uncovered skin, minor scratches or abrasions without bleeding, licks on the broken skin. Category 3. Single or multiple transdermal bites or scratches, contamination of mucous membrane with saliva from licks, exposure to bad bites or scratches. First aid. If you are bitten or scratched by a rabid animal, you must wash the wound thoroughly with soap and water for at least 15 minutes. Apply ethanol or a similar antiseptic to prevent secondary infection. Seek urgent medical attention. You need to start post-exposure prophylaxis as soon as possible. If you already had pre-exposure prophylaxis, you still need further treatment. Modern vaccines are the only way to prevent the onset of rabies after exposure. Traditional remedies such as jackfruit, gum, and chili powder do not stop the rabies virus. Please treat any potential exposure to rabies. Treatment. For category 1, no treatment is required, whereas for category 2, immediate vaccination. For category 3, immediate vaccination and administration of rabies immune globulin are recommended in addition to immediate washing and flushing of all bite wounds and scratches. For rabies exposed patients who have previously undergone complete pre-exposure vaccination or post-exposure vaccination treatment, 2 intramuscular doses of vaccine separated by 3 days are sufficient. Rabies immune globulin treatment is not necessary in such cases. Vaccination schedule. Intradermal vaccine approved by the WHO and DGCI. It's cost effective. 2-site regime. Doses are 0.1 ml intradermal site. Site is upper arm over each deltoid. Schedule. Day 0, 2 doses. Day 3, 2 doses. Day 7, 2 doses. Day 14, 2 doses. Day 28, 2 doses. Vaccination after re-exposure. Re-exposure after a full course of documented pre-post exposure vaccination with modern vaccine, 2 boosters, day 0 and day 3. All incomplete vaccinations, partial vaccinations or doubtful vaccinations need to be treated as fresh cases. Do's and don'ts. Do's. Physical. Wash with running tap water for mechanical removal of virus from the wound. Chemical. Wash the wound with soap and water. Apply disinfectant for inactivation of the virus. Biological. Infiltrate immunoglobulin in the depth and around the wound in category 3 exposures. Don'ts. Touch the wound with bare hands. Apply irritants like soil, chilies, oil, herbs, chalk, betel leaves, etc. Frequently asked questions. Do one need vaccination even if dog is immunized? Yes. Although vaccinated animals are more likely to transmit rabies, vaccinated animals can also do so if the vaccination of biting animal was ineffective for any reason. Do one need vaccination even if bite is due to provocation, assuming that dog is not rabid? Yes, whether a dog bite was provoked rather than unprovoked should not be considered a guarantee that animal is not rabid, as it can be difficult to understand what an attacking dog considers provocation for an attack. Do we need to observe the dog for few days before going for vaccination? The treatment should be started immediately after the bite. The treatment may be modified if animal involved remains healthy throughout the observation period of 10 days.